It's time again for the recording. So, people, and by people, I mean most of the people I just talked to in person, say that they like the long formats. Apparently, I jive better with those. So, I guess we're going to keep doing these like kind of really big ones. If I find the big one, I'm always at the whim of whatever I manage to find on Reddit, of course. But, if we find something kind of like a big story type question where it's like just one really big thing, I think I'm going to start favoring those, I guess, more than anything, because I think people really tend to like these. So guess what? I found another one in our back pain. Who'd have thought? Crazy, 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 crazy. This one, pretty long question. It has a lot of different components to it. This one, I'll probably just break it down as we go so that we're not here forever and I can kind of give you my immediate thoughts on it. As per the usual, I didn't really read it over necessarily. I just kind of look at it real quick just to see what's coming up. But everything that I do say is pretty candid in regards to what it is I'm reading. Sometimes it pays off, sometimes it doesn't. But I think most of the time I'm usually right, pretty close, if not, right on the money. We'll see how we do this time. So it starts, my disc herniation recovery story. I wanted to share my recovery story because when I was at my worst, success stories gave me hope. A few months ago, I could barely tolerate sitting. Riding in a car was extremely painful and nerve pain would shoot down my leg. Every flare-up made me think I was going backwards. Today, my sitting tolerance is much better. My leg pain has significantly reduced and I feel like I'm finally getting my life back. Here are the things that help me the most. Okay, so first, before we start going down these things, as a chiropractor, let's just say this person came into me. First couple things I'd want to make sure I know. What is the mechanism of injury? The mechanism of injury, what happened, the mechanism. Did you fall? Did you just kind of wake up with it? Did you pick up a sock? Did you happen to think a negative thought and something went shooting down your leg? There's a lot of different things that we could do here. What were some of the pre-signs? Were you starting to notice that your legs were especially tight? Is there a history of this? Did you, like I said, have some kind of really bad injury that maybe happened when you were younger? There's a lot of different things that can contribute to these, and those contributions will directly relate to how the treatment's going to happen. Let's see if it's possible for us to figure out maybe what's wrong, what happened to this person, while reading the things that tended to help. Or do a little investigative journalism here. So let's see what we can find. Number one, I avoided triggers instead of constantly testing myself. Whenever an activity consistently caused nerve pain, I backed off and gave my body time to calm down. Yeah, that right there, that usually speaks to like an overuse kind of injury. When a disc is hot, that can be not always the case, because when a disc does tend to break down, it just tends to get super sensitive. I agree. We've talked about it ad nauseum on this channel. When you are in pain, do more of the good, do less of the bad. Pretty self-explanatory. Just do the things that make you feel better. But if you're doing something and it causes you pain, that's not good. Discomfort can be okay. Pain, not good. Pain, no good. That's no good. It makes me the opposite of sad, which is das, and das no good. Number two, I love that joke, sorry. Number two, walking was my best therapy. Short walks throughout the day helped reduce stiffness and made me feel better. I gradually increased my walking as symptoms improved. Exactly how you're supposed to do it. Movement's good. Walking is the best kind of exercise you can do when you can't do much of anything else. It's probably good for even when you can do everything else. Walking is a really, really good way of exercising. Humans were designed to do it for very long periods of time. It's really good. It's a great way to get your entire body moving. Something that I have recently discovered is that humans get a lot of benefit out of sometimes walking backwards. Some of the tight areas that can manifest when you're walking forward for really, really long periods of time. If you walk backwards, it's actually a really clever way to stretch out parts of the foot that don't get stretched out very well, because we are designed to walk forward. And I've started kind of throwing it into my gym routine, and I like it. Actually, it makes your calves feel like they're getting a workout, funnily enough, because you're walking backwards. I usually do it. I try to do it at an angle too, like on a tilt on the treadmill. I really enjoy it. I think it's a good way to kind of help stretch out maybe the quads and hamstrings in ways that they're not used to, because they're not usually used to walking backwards. But that's kind of a neat little tip. 3, rest was important. When symptoms were flared up, lying on my back with my knees bent often provided relief. That is a direct influence from the leg muscles. Usually that's going to be from the quads and the hamstrings, because if the hamstrings are especially tight, they'll pull on the ilium, and that will cause the discs to get strained because they're being pulled in a way they're not super comfortable with, especially if this person's not stretching out hamstrings. Quadriceps, especially when you're standing, if they're especially tight, they'll do the same thing, just kind of like in the opposite direction. This is kind of just generically speaking. There's obviously a lot of nuance to this, but it's always a good idea to make sure your legs are nice and stretched out for any kind of disc problem, because it'll take the strain of the ilium area, the butt bone, if you will, for a less intelligent way of putting it, I guess. But that's something that I always recommend. Resting in this case is probably just taking a lot of stress off of it, especially if you're noticing it with knees bent. That tells me you probably want to look at leg muscles, just as a little extra bonus treatment there. Side sleeping help. Sleeping on my side with a pillow between my knees reduce strain on my low back. So when you sleep on your side with a pillow between your knees, what tends to happen is the pillow will cushion your knees because if you're sleeping on your side, a lot of people don't like their knees to be touching because it feels like prominent bone on prominent bone, which isn't always necessarily comfortable. But if you have a side sleeping preference and you have your leg constantly going over the midline, which is like you're laying on your side and you're putting your knee on the mattress itself. What that can do is cause a lingering pain in the hip, because it is essentially kind of like, it's kind of hard to describe, but it's like being angled out of the socket of the acetabular joint, which is where the hip bone sits, and it'll start to get scared because it thinks that it's going to fall out of your body, which is not good. And there's a bunch of ligaments there that are purposely, and muscles that are made there to keep everything in one piece. So that's why doctors and medical professionals usually recommend you sleep with a pillow between your knees, because it helps reduce the strain on that, and it also helps reduce the actual physical strain of like rubbing your knee on something, because the knee bone is very close to the surface, and that can make it kind of sensitive to certain physical stimulus around it. But again, just kind of something else to think about. That's why they recommend the pillow thing. And when you stop straining the legs, it stops straining the low back. Again, it's kind of more of like an indirect way of just making sure the goo goes back to where it's supposed to. Log rolling in and out of bed. This was a game changer. Twisting while getting out of bed often irritated my symptoms. Using the log roll technique helped a lot. Yeah, the log roll is when like when you're laying on your back, you actually just like physically like do a barrel roll, I guess is a good way to put it, out of the bed, and you can put your foot down and it can help you lift yourself up. If you are laying on your back and you do the straight sit up, like the vampire coming out of the coffin type sit, where they just like come up, that will often irritate the low back because you are moving the goo in the direction it doesn't want to go in the low back, just because of the way that disc is formed. Usually when there's a bulge or a herniation, it is being pushed backwards towards the outside back, right? It doesn't get pushed towards your stomach, it goes the other way. And when you're doing the up motion like that, when you actually hinge on the low back, it's pushing on the disc and forcing the goo out the direction it doesn't want to go. So that's why it's often helpful for people who are healing in these situations to do the log roll. A lot of times they have to do it just because they don't really have an option because of how bad it hurts. But again, that's one of the reasons why that's the case. I avoided unnecessary bending, lifting, and twisting. I use a grabber tool to pick things up whenever possible. And that's a good clue that even when you're not having back pain, it's probably a good idea to make sure you use your knees when you're picking stuff up. Don't bend at the waist. You're not supposed to do that. The spine is an elevator. It's not a crane. So whenever you're trying to pick something up off the ground, use your knees more than you think. Your low back will thank you. And again, or when you're doing like bending over to pick something up, it's the exact same thing as the bed thing, except you're standing. So when you're standing and you hinge at your waist, it's the exact same thing as when you get up when you're sitting, because the legs are straight and then you're taking your whole body and essentially, you're just doing a hinge down, which is the exact same mechanism. It's just you're not standing. You're standing instead of sitting. So it's not good. So when you do that, it's the exact same problem. You're putting a lot of force onto the disc itself, which is going to cause that herniation to get worse, or the goo to go in a place it's not supposed to. I minimize car rides. Driving was one of my biggest triggers, so I avoided it during the worst of my recovery. What is driving? The way I always look at driving is people don't think of it as sitting, but when you're driving, you're literally sitting in a seat, using your legs to manipulate pedals that drive you around places. So if you think about it, driving is literally just sitting. And when you think about the amount of time that humans sit, it is staggering, because people tend to forget that driving is sitting. I mean, it's not like a Flintstones car, right? Where you're using your feet to like push the car along. Like I said, it's one of those things. If you're having pain while you're sitting, or while you're doing that posture where your legs are straight, or they're like bent, and then your like upper body sitting on top of it, you're putting all the weight through that disc, and that is not good for the disc itself, especially if it's in the middle of healing. I changed positions frequently instead of sitting for hours. What did I just say? I rotated between sitting, walking, standing, and resting. My rough pattern was sit for 20 to 30 minutes, walk for 5 to 10 minutes, change position often. That's a great way to do it. Movement's good. Movement helps reduce the pain in areas that are experiencing pain, as long as it is a nice controlled movement and it's not harmful. I highly recommend that. Yeah, you don't want to sit around all day when you have low back pain, because it's just going to make that goo problem worse. The more you move and put movement into those disc areas and the spine bones around it and the little facet joints and all that, the more likely you are to have a better recovery, because movement's good. That's why walking is good, because when you walk, you move all that stuff in a way where the entire body gets to work together, and it kind of spreads the strain across the entire body. Kind of like how Sam said to Frodo, you got to share the load. Share the load. Physical therapy was not right for me. This is not advice for everyone, but some PT exercises aggravated my symptoms significantly. Once I stopped doing the exercises, they were causing flare-ups. I improved. One thing I learned is that what works for one person may not work for another. Listen to your body. 100%. That is one of the biggest things that I like to advocate for on this channel for sure, is I'm a chiropractor. I'm not your chiropractor. Maybe chiropractic doesn't work for you. It works for me, and it works for a lot of... Do you guys like my tie? Found it in a thrift store. It's quite a goofy. I love blue plaid. I don't know what it is. Anyway, but yeah, you figure if you don't find chiropractic particularly helpful, that's okay. Sometimes people don't get the full benefit out of it that they might get out of something that is like PT. And then I think even it was the last story or the one before that, there's some people that go to PT and they're like, I don't really like this, and then they'll just do it on their own, or they'll have better results if they just do their own exercises. It doesn't make you wrong. That's the great thing about healing. great and bad, I guess, is that you can have people heal at different rates doing different things. And one way of doing it isn't necessarily always right, which is why I think that healthcare practitioners and professionals have to kind of work on a pivot. So if you can't swivel and help people based on what it is that they in particularly need, then I think I don't want to say you're doing a disservice per se, but I do think that they might find benefit somewhere else. And sometimes that's just as easy as just trying a new move that you've never tried before, or even, again, just listening to what they're saying. And sometimes just being like, yeah, I know you're not noticing like a huge benefit out of this right now, but if we try this, maybe we'll do like a different thing. Let's do a test right after we do a certain kind of thing or some kind of treatment, and we notice an improvement. Let's start going into that direction. More of the good, less of the bad. That's what I'm talking about. Foods I chose during recovery. I focused on high protein foods, homemade goat bone broth, milk, turmeric, ginger, and black pepper drink, 3 to 4 boiled eggs most morning. I can't prove these healed my disc, but they were a part of my recovery routine. That's actually a really interesting thing to focus on when you think about your recovery. Diet is something people very commonly do not think about. If you want to heal, the body needs protein. It's essentially the backbone of most of the things that are used to produce the healing factor. Essentially, I guess, I don't know if that's the right way to put it, but like if you ever injure a muscle, it needs protein in order to make the repaired muscle substance in order for your body to be able to heal it. Protein is the first thing that you should go for if you are injured, which is why I really like those little protein drinks. Those are great just to kind of get a quick little shot. If you're ever getting protein in a single, I guess what you could call like a meal, 30 grams is kind of what you're aiming for. Anything more than that and your body doesn't absorb it super efficiently, it kind of likes to do it in 30-gram chunks, I guess might be a good way to put it. Homemade goat bone broth is, again, probably pretty protein filled. I imagine this, broths are usually pretty filled with a lot of the stuff that you need, and it's a lot of water. So there's a lot of water in broth, and obviously humans are made of water, and your blood needs water in order to function, and water just kind of helps lower inflammation and all that in general, because it kind of helps wash out a bunch of the stuff that it kind of keeps everything in balance, I guess might be a good way to put it. Milk. I don't know if milk necessarily helped. A lot of people say that milk is good for your bones. I hate to break it to you, that is an industrial marketing scheme. It's not as good as you think. I'm sure there's research that'll go both ways, but this chiropractor is firmly in the camp of no, it doesn't actually help your bones. Vitamin D and calcium. Vitamin D is really good for the bones. Calcium, not as useful for the bones as you might think. Obviously, the bones have a lot of calcium in them, but getting it from an extraneous source, like to the extent that they make it seem like milk, like if you listen to the marketing from Big Milk, they make it sound like if you don't drink milk, you're literally going to turn into dust. It's not the case. It's not as important as you think. If you like milk, drink milk. Humans weren't really designed to drink it past a certain point, in my opinion. Again, that might be a bit of a controversial topic. I don't think milk's all that important. There's better places to get things. If you want vitamin D, I actually would say it's probably better to just supplement it. But if you like milk, go for it. I don't know if milk naturally has a ton of vitamin D. I just think it's just reinforced in American milk anyway. Actually, that one I'm not entirely sure. Anybody who knows me personally knows that I can't stand the taste of milk. It makes me feel sick, but I'm not necessarily lactose intolerant. I just think it tastes disgusting personally. I know people really like it. I'm gonna get grilled in the comments for that one, I'm sure. Turmeric, ginger, and black pepper drink. Those are all really good anti-inflammatories. Those are just good for healing in general. Turmeric and ginger especially. I don't know a ton about black pepper. I'm pretty sure black pepper is healthy for you. I think it lowers like carcinogen food risks, I think, as far as I know. It's like a good season. It's a good seasoning to do for anti-radicals, I think, off the top of my head. I'll probably put a little thing here if I'm right on that or not. That one I'm not entirely sure on, actually. That's just something that kind of comes to the top of my head while I'm thinking about it. But yeah, turmeric and ginger, super helpful for anti-inflammatory stuff. And you should give it a shot. I think it's quite useful. 3 to 4 boiled eggs this morning. That's a protein thing yet again. The yellow of the egg is very filled with protein because the yellow of an egg was the chicken, and the chicken, when it is being grown inside the egg, needs a certain amount of protein because that's what makes the building blocks of existing. So it's very high in protein. I know that it goes back and forth in the research world or the marketing world, whatever you want to call it, where it'll say like eggs are worse than smoking sometimes, and then literally the next day it's like, oh yeah, eggs are the best thing you could possibly eat, and then the next day it's like, oh yeah, if you eat an egg, your cholesterol is going to explode and you're going to die, and then the next day it's like, oh, it's the best thing you could possibly eat in your entire life. It's just eat it or not. Eggs are good for you. I mean, but it's like if you do anything in like extremes, like I'm sure maybe eggs might stop being good for you. Like, I don't know, that you're getting real nitpicky on that one. I think eggs are a great source of protein. I personally like them over medium myself. I'm not a big fan of hard boiled eggs per se. I think that's kind of gross, but that's just a taste thing to me. But yeah, eggs are good for you. I don't care what anybody says. I'm picking a camp now. I'm firmly in the wonderful world of technology. This thing just stopped recording my voice halfway through the video, and I finished it and didn't realize it until the end. Thank you, OBS. Anyway, we're gonna pick up where I thought I left off. Yeah, we were talking about eggs, I think was where it actually stopped picking up my voice. Yeah, I'm firmly in the camp of eggs are good. Eat eggs. do it. And then number 11, bathroom habits matter more than you think. This may sound like a small thing, but it made a noticeable difference during my recovery. I avoided sitting on the toilet for long periods. I tried to keep my knees bent and used whatever position felt most comfortable for my back. I avoided straining whenever possible. I stayed hydrated to reduce constipation. The biggest game changer for me was using a bidet. I went into a whole thing about how bidet is spelled weird, so I guess I'll do it again. It's pronounced bidet, not the, a good old bidet. Don't use a bidet. Don't use that. Use a bidet. The bidet not only made cleaning easier, but I found that a gentle stream of water helped me relax during bowel movements. On days when I was constipated, it seemed to make things more comfortable and reduce the amount of pushing and straining I needed to do. Less straining, less strain on my back and irritated nerve. For me, this was one of the small daily habits that added over time and made recovery a little easier. Now, there's a reason that this is the case. There's a linkage between low back pain and something like constipation or some kind of change in going to the bathroom. Whenever you have low back pain, especially that is nerve or spinal related, what can happen is that whenever the nerve roots that are in the lumbar spine, a lot of them tend to go to the intestines, usually the large intestine, which is where going to the bathroom kind of happens, is kind of the easy way of putting it. It will essentially go through the large intestine, it sucks all the water out of it, and then it pushes it out at the end tube. And if anything happens to the nerves that go to those areas, it will impede the ability to function everything downstream that goes on in that nerve itself. So let's just say L5 is usually the main culprit. L5 does have some stuff that happens in the intestines. What can happen is if you have distress in that area, it's not able to get afferent and efferent nerve force essentially up and down the spine, so that it takes longer and it's much harder for the body to push information to where it's going. In this case, it would be the intestines. And also it takes it longer to get back up to the top. So you have a little bit of a delayed response in a lot of ways, which is just kind of like a part of healing in some ways, which is why getting adjusted and all that, a lot of times if people are having bathroom issues, if you get adjusted in the low back, it tends to help loosen everything up. It's not that we're technically like unkinking a hose per se, but what can happen is that you give the nerves a little bit of like a kick and it will go downstream. It's I want to say it's called the Merrick chart. Very specifically has this information on it. I might throw it up here real quick if I'm allowed to. I don't know if this video might get taken down on that one because I think it's proprietary information. If you look at it, every nerve is linked with an organ, and the organ that is, and there's probably some implications in regard to like, it's not just one organ, but there's definitely there's some spread around, and every human's a little bit different because that chart is going to have a little bit, I'm going to say inaccurate. It's not inaccurate per se, but every person's nerves are laid out a little bit differently. Not everybody's exactly the same. So, these little changes like that. So sometimes one nerve that's L4 on one person going to a certain organ, maybe it's like L3 on another person. There's usually a little bit of like some overlap on some of the nerves, but regardless, something to think about in that regard. But yeah, if you get adjusted and all that, it can help reduce the nervous system's lagging in the intestines itself, which is why when you're in pain and all that, it can feel like constipation is a thing that happens right behind it. It's because the nerves themselves are starting to have problems, because chiropractors are nerve doctors. We are not only spine doctors. There's just a lot of nerves in spine, so we tend to focus on it quite a bit, but we treat the nervous system and the musculoskeletal system, not just the spine. We treat everything. Good chiro treats all of it in some form or another. Yeah, and then the knees bent thing, again, it takes some of the strain off the low back from leg muscles. Again, that would be probably one of the first things I would look at. And yeah, sitting is bad. Again, what we've kind of talked about that with the whole, I think we have, I don't know if you got to hear it or not, but yeah, if you just put gravity on top of a disc, it'll start to squish out, and that's just something that can happen. Biggest lesson here: healing is frustrating and slow. There are many weeks when I felt like nothing was changing. Then I would look back a month and realize I could sit longer, I could walk farther, my nerve pain was less frequent, my mornings were less painful, progress was not linear, some days felt worse, some days felt better, but the overall trend was important. Yeah, that's true. So healing takes too long for pretty much everybody, but it goes at the rate that it needs to go. So if you are healing, it's going to feel like it takes way too long because nobody likes to be in pain. When you're in pain, it stinks. Being in pain stinks. I hate to break it to you, but it's not, I can't really go any faster. And there's definitely a focus from the average person on the allopathic method of doing what we call healing. Allopathic is usually is associated with like the way being symptom focused, which is what the current, like I guess you could say, the American medical system. And so if you're only focused on symptoms, well, then healing takes a really, really long time. But you got to think about what the body is trying to do. When you look at it from a more holistic standpoint, pain just doesn't exist. Pain's not just like a thing that exists down the road. It's something that is influenced and thus influences back how your body is able to fix itself. If you don't have pain, your body really can't heal, but you can't heal without pain. So it's kind of like one or the other. And one of the downsides of only going at it from an allopathic standpoint is really, if you only treat the symptoms, the body can only heal it at the fastest rate that it can, which there's a ton of factors that are attributed to that, which is why a lot of times medication and all that is mostly focused on dealing with symptoms or helping relieve the symptoms so that your body can heal it on its own. That's kind of one of the big focal points of taking something like a medication, or at least most of the time. I'm sure there's always exceptions, but there's like, when it comes to like diabetes, that's a little bit different, right? You got to take insulin because your body can't really make it, or you're not sensitive enough to it. That's a whole nother kind of thing. But in regards to like going to an MD for like low back pain, they're going to be like, here's some muscle relaxers to help your body relax so you're not in as much pain so that the body itself can heal it. Is that wrong? No, I don't think so. But when you look at it from a more holistic standpoint, like let's just say you go to a chiro, we go in there and we introduce movement into these areas that are trying to get movement back into themselves. It's just taking way too long. That's why being treated, or one of the many reasons, why being treated by a chiropractor can help reduce the amount of symptoms you got to deal with, because you are essentially accelerating the healing by reducing the interference in the area. And that is ultimately what chiropractic does. It doesn't necessarily fix the problem. Sometimes somebody is just stuck and needs to be popped and then they feel better. And in a weird way, that is probably more like fixing the problem. But a lot of times when you have these more like bigger issues, when you go to a chiropractor, our focus is to facilitate the healing. It's not necessarily to facilitate fixing it, if that makes sense. Which is why we recommend the things that we do, which is why continued care is always helpful, because there's a lot of lifestyle factors that happen in this. If you physically fall and slam your butt into the ground as hard as possible, that's not necessarily a lifestyle factor. That's just something that needs to heal. Get treated, have it go away, make a call on what you want to do. But if your problem is something that is lifestyle based, unless you change your lifestyle, it's going to come right back. And that's not necessarily chiropractic's fault. Chiropractic is a really good way of dealing with it and potentially getting the upper edge on it per se. But again, there's a lot of like back and forth on this where, each person has to do their part, right? And there's an active part of care. There's a passive part of care. You got to use both of them to get the full recovery. Trust me, you will heal. It's only a matter of time. I just came back to post my success story so that I might give hope to somebody who is struggling, which is very nice of you. Thank you very much. Please comment or ping me personally if you have any questions on preparing bone broth or turmeric shots at home. I don't know what a turmeric shot is. Sounds gross. Sounds like it would burn the back of my nose. Maybe I'm crazy. I already know I'm crazy, actually. Let me pull up the questions that I already read. Awesome. First comment, the log roll technique does not get enough love. Couldn't agree more. I hadn't really thought of like actually recommending this to patients, but it's actually a really interesting way to get people to like get out of bed. Like, it's in my head, I'm thinking to myself, oh, they're going to do this anyway because they're going to be in so much pain that they're not going to be able to get up. But if you just recommend it at the very beginning, it might help prevent some heartache, shall we say. So I actually might start recommending that one to people. I think that's quite helpful. Second comment, what was your condition and what was the surgery? Okay, so this one, not a fan of this. Why is it that the first thing that somebody has to think of whenever there's a problem is there needs to be a surgery? No, that's not the case. If you're having some kind of injury or all that, the first thought you should have is what happened? What is the mechanism? Is this something that I can heal on my own, or do I need a surgical consultation? Should you go for the consultation at the beginning? Sure, absolutely. But I don't think it should happen. In most situations, there's always going to be exceptions to this, of course. But I think that if you don't attempt to treat something conservatively at the beginning, whether it's PT, self-done, however you want to call it, chiropractic, PT, whatever it is, I think you deserve to have to go through a way of healing it in a more natural way before you start talking about going under the knife, because that has a whole lot of other complications. And there's going to be changes in biomechanics. It's almost unavoidable. Is it bad? No. Do I recommend it if you need it? Absolutely. But I don't think that surgery should be the very first thing on your mind. That is not healthy. It's not healthy. Allopathic. An allopathic way of looking at things. So here's another comment that is, just kind of a little bit storytelling, kind of similar. I'm also seeing some improvement in my symptoms after I was feeling hopeless. Femoral nerve compression at L3, L4 was completely debilitating. I couldn't walk more than 20 steps at a time, and even that was too much sometimes. Laying down also hurt. Sitting was the only relief. 2 months later, and I still have pain, but I can walk 10 plus minutes, sometimes 20 plus, before I have to stop. What helped? Ice, a TENS unit, child's pose, bending forward, manual spine compression at physical therapy. Should be said, manual spine compression there's some similarities to that in chiropractic adjustments. Just saying. Just gonna throw it out there. Meds, combination of gabapentin, muscle relaxers, and ibuprofen. This is after 4 days hospitalized with IV pain meds and steroids to get the initial pain under control. I'm still keeping my neurosurgery consultation appointment for the end of the month because I do still have some pain along with significant weakness and mobility issues. I'm optimistic I won't need surgery though. I hope this gives others some hope. So yeah, there you go. That's kind of similar to what I've been saying. At least I think I have. Again, I don't know what got cut out or what didn't get cut out with that silly video. Look at this thing. It's like a spring. Here it gets crazy. Anyway, the TENS unit's really, really good at helping distract the skin from feeling pain. TENS units in themselves, especially the lower grade ones that most people can get at home, probably not a lot of healing that can happen with those because the strength of the unit isn't strong enough to to instigate cellular changes, but it's really, really good for helping kind of distract you from pain while your body's trying to heal it on its own. It's quite helpful in that regard. They're pretty useful. They're not too expensive. I think you can get them pretty cheap at even like general stores. Like I think you get one like a CVS. Obviously, I don't get any kickback from that. I don't get paid by CVS to tell you that. Just a tip. Manual spine compression at physical therapy. Depending on what the PT's doing, PTs do have the option of having what they call like an elective for adjustments. They're a little bit different than chiropractic adjustments. They tend to be more what they call long lever, and chiropractic adjustments tend to be short lever, which it's kind of just how it works. There's not like, as far as like the adjustments go, theirs tend to be a little bit more macro, ours tends to be a little bit more micro. We'll like kind of hone in on like a specific spot, while PTs might generally speaking, I said this very generally speaking, might focus more on a spinal segment as opposed to a specific spinal bone. Not that any way is better than other. If the person gets better, who cares? As long as the same method as long as the method works, I don't really care, the terminology of it. I don't get pedantic in that regard. Gabapentin, muscle relaxers, and ibuprofen. Like I was saying earlier, really, really good for helping with pain control. But if you take those only by themselves, it doesn't necessarily fix the problem, but your body might be able to fix it during the time that you're dealing with less pain while you're taking those medications. The best thing you can do, keep moving, keep doing some light exercise, get that blood pumping. One of the best ways you can heal. Do more of the good stuff, do less of the bad. Don't do things that hurt. Hurting's bad. Don't do that. And something that did kind of come up to me is, technically speaking, the femoral nerve doesn't come out of L3, L4. The femoral nerve is a kind of like a combination of different things that goes further down, like a different segment. So it's like, technically speaking, femoral nerve compression happening in the spine. I don't know how like technical you want to get on that one. It might just be the way that it was described to this person from their MD or something like, or their chiro, whoever. That might just make sense to them. But technically speaking, femoral nerve compression, I don't think can happen at the spinal level. I think it's a little bit further down. Usually femoral nerve compression happens probably more in like the quad, ilium ligament type area. It could get like a little caught up in there. But I guess I never really thought of it. It might be like if it could come from the spinal segment, like specifically for femoral nerve compression. Like obviously the femoral nerve is probably downstream from the spine in that area, but in itself, I don't think it's exactly where that is. Well, there you go. I think I'm going to leave it at that. Yeah, that was a pretty concise question. Similar, but not quite as in depth to the question from last week. Maybe next time I'll try and do something that's not just like, hey, I have back pain and I managed to conquer it. I'll find something a little bit more, I don't know, maybe more like mental focused, or even just like a diet focused-y type question, because these are really inspiring in a way. And a lot of times the information that you get is very, very helpful, but it doesn't really specifically go over different mechanisms, which is why I thought that falling down one that we did last week was as interesting as it was, just because you knew we could figure out exactly what it is that happened. Again, looking at what happened with this person, if I had to guess what caused their issue, is I'm going to guess that they were bending and their disc eventually just kind of gave out. I don't know their age, but if I had to guess, this is probably around when they're like late 30s going into that 40s area, because that's when the discs finally start having some trouble keeping up with the fast-paced life of bending over at the waist, especially if you have a job that makes you sit a lot, where you just put a lot of pressure on the disc all the time. Eventually something's going to get a little stressed out, shall we say. I thought that was a really good episode. But yeah, I'll see you guys next week. Hope you guys keep it popping out there. Thank you very much for watching this video. I love you. I hope you have an absolutely wonderful week, and I'll catch you next week. See you later. Bye.